Good morning, everyone, and thank you for joining us on our Connections Between Education and Health webinar. My name is Becky Sestersick-Carroll, and I am a Health Policy Analyst at the Health Policy Institute of Ohio. We are very excited to be hosting this webinar to officially wrap up our policy brief series exploring the connections between education and health. This work started all the way back in the summer of 2016 when we received dedicated funding from the United Way of Central Ohio to draft a policy brief exploring the relationship between education and health. The first thing we did was convene an education and health policy advisory group to guide our work. This group was comprised of individuals from around the state from both the health and education sectors. We were able to learn from each other and explore mutually beneficial policy opportunities to improve both health and educational outcomes. Once we got started, we realized how much opportunity there was, and it turned into a series of 4 policy briefs shown here. And the last of these briefs was just released in August. We also developed 2 shorter fact sheets shown here and an online resource page that contains even more information. All of this can be found on our website. Before we get into today's agenda, I'd like to explain why we decided to devote so much time to this work. The first reason is that health and education are the 2 largest shares of the state budget, representing 88% of total state and federal general revenue fund appropriations for state fiscal years 2018 and 2019. They are also the topics of a considerable amount of legislation in the Ohio General Assembly. Education is one of the key social determinants of health. For those of you familiar with HPIO's work, this pie chart may look familiar. It shows the modifiable factors that influence a person's health. And as you can see, a person's social and economic environment determines 40%, and education is a critical part of that. During this webinar, Amy Bush-Stevens and I are going to give a brief overview of each of the 4 policy briefs. And we are also excited to be joined by 2 guest speakers who will discuss recent state-level initiatives that seek to improve health and education outcomes for Ohio students. After I provide overviews of the first 2 briefs, Sarah Wickham from the Ohio Department of Education is going to discuss Ohio's recently released School-Based Healthcare Support Toolkit, which was developed as a joint effort by the Ohio Department of Education, the Ohio Department of Medicaid, the Governor's Office of Health Transformation, and the Ohio Department of Mental Health and Addiction Services. Amy will then discuss HPIO's 3rd and 4th briefs. And then we will hear from Tia Marcel Moretti from the Office of Ohio Attorney General Mike DeWine. Tia is going to discuss the Drug Use Prevention Resource Guide that was developed for Ohio schools and released a few months ago. And then finally, Sarah will come back and tell us about Ohio's strategic plan for education and how health fits into it. Slides from today's webinar will be posted on the events page of the HPIO website. Going way back to the beginning, we released the first policy brief in the Connections Between Education and Health series in January of 2017. It was meant to bring this relationship to light and explain the factors that contribute to it. This slide shows 3 key takeaways from brief 1. First, people with higher levels of education have better health outcomes. Number 2, healthier students are better learners. And finally, partnerships between the health and education sectors are very valuable. In the brief, we identify 3 primary ways in which education and health are connected. First, education impacts health through creating opportunities for better health. Secondly, the relationship also goes in the opposite direction, in that health can affect educational success. And finally, there are other factors, things like poverty, geography, stress, and parenting, which influence both health and education outcomes. Research shows a strong relationship between a person's health and level of education. This chart shows the percentage of Ohio adults who rated their health as being either fair or poor, and it's broken down by highest level of educational attainment. So you'll see that 40% of those without a high school diploma rated their health as fair or poor, compared to only 6.6% of college graduates. Similar wide gaps exist in chronic disease prevalence and life expectancy. For example, someone who has not graduated from high school is expected to live an average of 9 years less than a college graduate. The brief discusses several reasons why higher educational attainment leads to better health. For example, more education generally allows people to get better jobs, which pay higher salaries and offer better benefits such as health insurance. These financial resources then pave the way to better health through the ability to live in safer and healthier communities that have more access to healthy food, more opportunities for physical activity, and stable housing free from toxins such as lead. And it also enables better access to healthcare. The second part of this relationship is that health can also affect educational success. When children are not physically and emotionally healthy and well nourished, they're more likely to miss school and may not be able to pay attention and learn while they're in school. And of course, both of these factors can hinder educational success and academic achievement. This cartoon illustrates some of these non-academic barriers to learning. As you can see, the little boy's concerned about getting to math class, but he has all these big, heavy suitcases that are keeping him from getting there. Finally, the third aspect of the relationship that we discuss in the brief involves other factors that impact both health and education outcomes. For example, we discuss how a lot can happen to impact a child's future academic achievement and health before he or she even steps into kindergarten. And Amy Stevens will touch on some specific examples later when she talks about brief number 3 on early childhood. With this first policy brief, we wanted to bring this relationship to light so policymakers would realize that health and education are linked, and that an investment in one area may also represent an investment in the other area, or a policy decision in one area will likely impact the other, and this is something to be mindful of. For these reasons, partnerships and collaboration between the education and health sectors are very valuable. This slide shows some of the health and education related state agencies, as well as some of the relevant legislative committees that could partner. In the following 3 policy briefs and 2 fact sheets, we highlight evidence-informed policies with both education and health benefits. In addition to the information we share with you today, each of these briefs also includes policy options, which we're not going to go through on this webinar, but we would encourage you to download the briefs and take a look. So the second brief is a great example of how partnerships can be valuable. It discusses the provision of health services in schools. In addition to what I already mentioned about health influencing education outcomes, here are key takeaways from this brief. First, a considerable number of Ohio children have mental or physical health conditions. Number 2, schools are well positioned to identify and address student health needs. And 3, schools can't do this alone. They simply don't have the time, financial resources, or the capacity. So these partnerships are important. This brief focuses on this part of the relationship, or how health impacts education. The prevalence of chronic health conditions among children has increased in recent decades. A few examples of common health conditions found among Ohio's school-age children are shown here. There are no federal or state laws requiring schools to provide comprehensive health services to all students. There are a few health service requirements under Ohio law, which are shown in this table, and this table can be found on our website. The brief also touches on a few key federal and state policies and programs that outline requirements related to the provision of health services in schools. For example, the Medicaid Schools program in Ohio allows Medicaid to pay for Medicaid reimbursable services that are delivered to Medicaid-eligible children who receive services that are included or indicated on an IEP. IEP stands for Individualized Education Plan, and they are for students with special needs. Schools are well positioned to identify and address student health needs, given that nearly all children attend school an average of 6 hours a day, 5 days a week for 8 or 9 months a year. More and more schools are recognizing that healthier students are better learners, and many have started to offer more health services to students. This slide shows a few of the benefits of doing so. For example, when a child is seen by a healthcare provider in the school, he or she is missing far less instructional time, and the parent does not need to miss work. And of course, providing healthcare in schools is also a way to increase access to care, especially for children in low-income families. And of course, the idea of providing health services in schools is not a new concept. Schools often employ healthcare professionals, and a few of the most common types are shown here. However, with limited resources, schools can't afford to employ an adequate number of these professionals to sufficiently serve all students. After the repeal of what was called the 5 of 8 rule, there's really no requirement for schools in Ohio to employ these types of professionals. Because schools can't afford to hire many of these professionals, forming partnerships with healthcare organizations in the community can be a powerful and cost-effective option. As you can see on this slide, these partnerships can take several different forms along a continuum. They range from simply establishing a strong referral network or having contracted school health professionals to what is called a community school. Please note that I'm not talking about charter schools here, although Ohio does call its charter schools community schools, but this is a different concept. In addition to providing health services, community schools also typically have partnerships with other community social service organizations. So healthcare and other types of support are available to students and their families. For example, food assistance might be another service that is offered. The types of health services provided vary based on community need, but typically they include primary care and preventive services, but they can also offer dental, vision, or mental health services, as well as other wraparound services. The type of partnership that we discuss most in the brief is school-based health centers, or I'll refer to them as SBHCs. Here are some pictures of SBHCs located in Cleveland and Cincinnati. School-based health centers are health clinics located within a school or on school grounds that deliver health services to students. Some also serve school staff, parents and siblings of students, and even sometimes other community members. School-based health centers and school-linked health centers are an evidence-based strategy that has been shown to improve school performance and grade promotion. And they're also associated with various positive health outcomes. Some examples include increased delivery of preventative services, decreased asthma morbidity, and fewer emergency department visits and hospital admissions. They've also been shown to reduce health disparities and gaps in education outcomes when established in low-income communities. SBHCs are typically sponsored by an external entity, which is usually a healthcare provider, such as a federally qualified health center, a hospital, or a local health department. And the sponsoring entity operates and administers the school-based health center and employs or contracts with staff to provide healthcare services. SBHCs are typically staffed by a physician's assistant or nurse practitioner, but they can also include a larger multidisciplinary team of providers. In the brief, we also discuss a few barriers to school-based healthcare, and a few are listed on this slide. However, the state of Ohio has developed a toolkit to support schools looking to form or strengthen school healthcare partnerships. And we are now going to hear more about this toolkit from Sarah Wickham, who is the Senior Policy Advisor at the Ohio Department of Education. She works on policy, communications, legislative action, and other key initiatives. Sarah came to that post following her role as Ohio's teacher liaison, where she worked with the state superintendent and the governor's Office of 21st Century Education on major reform issues such as teacher evaluation, Ohio's third grade reading guarantee, academic distress commission reform, and the state's A through F school and district report card system. She's a former elementary school teacher with Gahanna Jefferson Public Schools and holds both undergraduate and graduate degrees from The Ohio State University. So I will now turn it over to Sarah.
Thanks, Becky. So over the last several months, the Ohio Department of Education, Department of Medicaid, Department of Mental Health and Addiction Services, Department of Health, and many other partners have really come together to try to figure out what we can do to support existing school-based health partnerships and to encourage new or expanded partnerships in our state. And one thing we realized pretty early on in this work is that good, free, Ohio-specific information was not easy to find. So we built the School-Based Healthcare Toolkit with many of our partners, and you can see a screenshot of that toolkit on your screen. It's a little bit difficult to read, so you can see this at any time on our website. It's education.ohio.gov, and you just enter school-based health into the search bar and you can pull it up yourself. But I'm going to walk you through some of the pages in this toolkit in the next few minutes, and then I encourage you to visit it yourself so that you can see in more detail what I've talked about. So we structured the toolkit to be very user-friendly. We wanted to make sure that it was organized around perceived barriers to starting school-based health partnerships. So you can see there are barriers like just the general, how do we get started? How can we figure out what our chief health needs are and what providers to partner with? How do we educate families, teachers, and the community on our model and get them to buy in? So these are pretty simple questions with really complicated answers. You know, HIPAA and FERPA are terrifying to schools and districts who are interested in pursuing school-based health partnerships. So we've provided resources on how to navigate these things. So I want to focus a little bit on some of the aspects of the toolkit. So as you can see, if you look at the toolkit homepage, there's a link for assessing communities specific issues and resources. So understanding community need and readiness is obviously a high priority in starting a worthwhile sustainable school-based health partnership. So at that link, you will see some questions to define need, questions that help you define readiness, and a lot of guidance about data. So there is a ton of available data out there if you know where to look, and our partners at HPIO actually really were very helpful in designing this piece of the toolkit. But schools and districts may not know what to look for or where to begin. So we have some information about utilizing data you already have, utilizing publicly available data, and then if you can't find the data you need, what you would need to do to survey your community to figure out what additional information you need. So these are some of the data resources available. You know, from a school perspective, this information is really overwhelming. So being able to sit down with a provider partner to walk through some of this available health information is really, really helpful. Also, engaging stakeholders and providers is another really key element in getting a school-based health partnership off the ground. So we have a link right here, plan for engaging and partnering with the provider naming care providers, school security procedures. Also, everyone always wants to talk about money. So we have some information in the toolkit about money. So there are a wide range of funding and resource options to fund a partnership like this. So we have some potential resources. Actually, the neat thing about this list is that these are resources that are currently being used by existing school-based health partnerships in our state. So this is not just like a random list of Googled grant programs, but these are the funding sources that existing partnerships are using. So we know they work to fund this type of partnership, and an easy one-stop shop for all of that. Also, the Every Student Succeeds Act, the federal education law, also provides some funding for schools and districts that may be helpful for funding a school-based health partnership. There's competitive funding. There was federal and national and local. Non-competitive funding sources. And then financial support to medical professionals that want to provide health services in underserved areas. Finally, there are some community partnerships that you may want to explore for resources to support school-based healthcare. So I ran through that very, very quickly. So you can see that bottom link there, education.ohio.gov/SB Healthcare Toolkit, or you can, again, just go to education.ohio.gov and enter school-based healthcare into the search bar, and you can explore this resource for yourself. You can also contact our team at school-based healthcare at education.ohio.gov if you have any questions about the resources that I shared today.
Good morning, everyone. This is Amy Bush-Stevens at HPIO, and I'm going to be talking about the third and fourth policy brief in this series. So about a year ago, we released the third policy brief, which focuses on early learning. These are three key takeaways from that policy brief. The first is that the first years of a child's life are extremely important for future health and educational attainment. The second is that high-quality early care, education, and family support programs have many beneficial outcomes that are important to policymakers and important to all of us. And finally, that many Ohio children do not currently have access to high-quality programs. And in the policy options section of the brief, we go into some ideas for how we can expand the reach of these high-quality programs to more Ohio children. The first 5 years of a child's life are a time of both great opportunity and vulnerability. Early childhood lays the groundwork for physical, emotional, social, and intellectual development later in life. And we know that the human brain grows more quickly during infancy and early childhood than at any other time. So relationships with nurturing, responsive caregivers in early childhood really supports healthy brain development. On the other hand, harmful or traumatic events in the early years can have lasting negative effects on health and school outcomes. So these are examples of adverse childhood experiences. I assume most folks on the webinar today are familiar with ACEs. Children are exposed to ACEs are at increased risk for developmental delays and serious physical and mental health conditions later in life, including things like heart disease, cancer, and addiction. So to recap, early childhood is a time of great opportunity, but also of vulnerability. And it's therefore very important from a policy perspective, if we're interested in improving health and education outcomes, that we focus on early childhood. And it's really important for reducing gaps between different groups. In the brief, we take a look at these three types of programs that have strong evidence of effectiveness.
The first is home visiting, and home visiting programs are a great example of a multi-generational strategy because they help both the parents and the children. Outcomes vary by model, but include things like improved kindergarten readiness, reduced child maltreatment, and improved parenting skills. And of course, in Ohio, we have the Help Me Grow program that's administered by the Department of Health, and it offers home visiting for some low-income families and pregnant women. And then we also have some local programs in some communities in Ohio. And Help Me Grow implements several different evidence-based models, including the Nurse Family Partnership and Healthy Families America. Early childhood care and education includes childcare, preschool, and pre-K. And there are many short and long-term benefits of early childhood education, including kindergarten readiness and school success. And I want to emphasize here that quality is really important because enrollment in low-quality programs may do more harm than good. And it's important for high-quality early childhood education to be followed by high-quality education in the later years to maintain the positive outcomes. Unfortunately, high-quality childcare and education is unaffordable for many families, and costs have increased at double the rate of inflation in the past 20 years, which I'm sure is not a surprise to those of you with young children. Looking at social emotional learning, it builds skills to engage with others, manage emotions, show empathy, and maintain positive relationships. Research shows that social emotional learning programs can improve academic and mental health outcomes, and the Good Behavior Game, Second Step, and PATHS are examples. There are two important things to note about all three of these programs. The first is that the earlier these interventions are started in a child's life, the greater the benefit. This slide shows the estimated return on investment of interventions at different ages. Second is that many Ohio children do not have access to these programs. For example, only about 5% of Ohio children under age 6 living in poverty received home visiting services from one of the state programs in state fiscal year 2016. And only 39% of low-income children in Ohio were enrolled in a formal early education program in 2011 to 2015. This is really important to think about when we're thinking about disparities in health and education outcomes. High quality early learning interventions can be a powerful strategy for achieving equity, but only if we reach more children throughout the state. Now I'm going to move on to the last policy brief in this series, which focuses on school-based drug and violence prevention and mental health promotion. And here are the key takeaways from that brief. So the first thing is that the same things that work to prevent drug use also improve other outcomes, such as school success, improved mental health, and reduced violence. Second is that a comprehensive school-based approach involves prevention education, but also goes beyond that to include social emotional learning and positive behavior initiatives and school climate. And finally, Ohio can do more to scale up and coordinate school-based prevention activities. We really are doing a lot in Ohio, but we could be doing more and we could be doing better and reaching more kids. And in the policy options section of the brief, you can find some specific ideas for how to really scale up what we're doing in terms of evidence-based prevention. I want to emphasize why prevention is so important in the context of the opiate crisis. Right now, policymakers, I think, are frustrated because the opiate crisis feels like whack-a-mole. Once we got a handle on opioid prescribing, then the epidemic shifted to heroin and then to fentanyl and now to methamphetamine. So comprehensive universal prevention is the way to address this in an effective way that gets us away from whack-a-mole. These are the topics we cover in the brief. We all need an umbrella today, so I'm glad we have this graphic. There are several data graphics in the brief, but I'm just going to share a few here that really stood out to us. This chart shows the trend in major depressive episodes for teens in Ohio and the US. Two important things to note here, obviously the increase from 2011 to 2016, and that Ohio's rate is now higher than the US. And we know from US data that the rate has particularly increased for girls. And this is a really important trend to pay attention to. And we know that 58% of kids who had a major depressive episode did not receive mental health services. Behavior problems are a big concern among teachers and school administrators, and this chart shows out-of-school suspensions for Ohio children broken out by income, race, sex, and disability status. So you can see there are some pretty big disparities here, with African American students in particular experiencing the largest number of suspensions. And this is similar data looking at different types of disabilities. Now let's look at evidence-based approaches to preventing these and related challenges. There are many different policies, programs, and interventions that are effective to prevent drug use and violence and promote mental health and well-being and positive behavior. And really the foundation for all of this is family and community and early childhood at the bottom of this pyramid here. Today, I'm focusing on the school-based piece, so those top three layers. Typically, when we think about drug and violence prevention, we might think about classroom prevention programs like DARE or Life Skills or Project Alert. And those are examples of universal prevention programs delivered to all kids, usually in a grade level, usually in middle or high school. But social emotional learning and school climate are also important prevention approaches that connect to many different outcomes. These are a few examples of prevention education curricula, and prevention education can be delivered as part of a health education class, or it could be part of a broader school or community-based prevention program. Health education is the only content area without academic standards in Ohio, and this means that the quality and quantity of health education varies quite a bit from district to district. We do have a graduation requirement for half a unit of health education in Ohio. And the content of that health education is partially dictated by a series of state laws that require schools to teach students about the specific topics that are listed on the right hand of this slide here. I want to emphasize that Ohio is the only state without health education standards. Education standards are a useful tool for helping schools to develop or select their health education curriculum. Standards outline what a student should know and be able to do at each grade level, while leaving the development of specific curricula to teachers or other local specialists. Senate Bill 287, introduced this year by Senator Sykes, would require the Board of Education to develop and adopt health education standards, and it's currently pending in the General Assembly. The next element in the comprehensive approach to school-based prevention is social emotional learning, which I talked about earlier, and positive behavior initiatives, such as positive behavior interventions and supports, or PBIS. And Ohio schools are required to implement PBIS, although there is not currently tracking of how districts are implementing PBIS. If you would like to learn more about PBIS, you can check out the fact sheet that we have posted on our website. School climate is a broad concept that sometimes is referred to the quality and character of school life. And this diagram here is the U.S. Department of Education model for school climate. The benefits of school climate include fewer disciplinary problems, improved academic achievement, and less alcohol and drug use. The SAFE Act is legislation that was passed in the Ohio General Assembly just this past June. It was sponsored by Senators Lehner and Manning, and the goal is to improve school climate by reducing out-of-school suspensions and expulsions and increasing positive behavior support. The law applies to pre-K through third grade and, among other things, limits the use of out-of-school suspensions and expulsions, requires schools to do reporting on suspensions and expulsions, and appropriates $2 million in grants for PBIS and social emotional learning programs. To recap, this is the framework that we've used for a comprehensive evidence-based approach to school-based prevention. And these strategies are already being implemented in some Ohio communities, but we really think that more can be done to deploy them in a more widespread way that protects all Ohio children from future addiction, violence, and mental illness. These are a few examples of the many state-level policy activities currently happening in Ohio that are roughly aligned to the comprehensive framework. And going forward, we think there are many opportunities to better coordinate these efforts to ensure that all children are reached. And now I'm going to turn it over to Tina Moretti from the Attorney General's office, and she's going to talk about one such effort. Tia is a licensed social worker and Ohio certified prevention consultant who's been working in community-based mental health and addiction since 1998. She was involved in development of the Franklin County Opiate Crisis Task Force, and she currently serves as Director of Statewide Substance Use and Social Services for the Ohio Attorney General, Mike DeWine. So take it away, Tia.
Good morning. Thank you, Amy, for having me. I'm really excited about this webinar and to share our drug use prevention resource guide out of Ohio Attorney General Mike DeWine's office. So again, thanks for having me and thanks for the time. As we know that Mr. DeWine is well immersed in prevention efforts since the 1980s, including being one of the founding members that around the community for the drug-free community grants. They're still alive and vibrant today. They require full community collaboration, including schools. On the heels of the epidemic, of course, Mr. DeWine brought together the Ohio Joint Study Committee on Drug Use Prevention. Therein, some of our leading peers and senators and representatives made decisions about how to move forward in recommendations that were easily digestible at a community level for all people to be involved in K through 12 education and prevention education. Well, we took the feedback that we received from the Ohio Joint Study Committee. We released those recommendations about 1.5 years ago, and we had folks come to us and say, you know, administrators at schools, preventionists, social workers, these are great, but I don't know how to apply them, and they don't feel very practical. So even though, you know, we had all of the right people in the room, once again, these things just didn't really shake down at a local level to help people feel empowered with the information that they needed to move forward and make holistic decisions and strategic partnerships in their community. So we went back to the drawing board. We called together our joint study commission. We worked with the Ohio Department of Education and some of our friends at the Prevention Action Alliance, as well as several senators and representatives. And we brought out the Drug Use Prevention Resource Guide. This guide was specifically to be a walkthrough for anyone in a community to be able to pick it up and start prevention right there and then, specifically using the Strategic Prevention Framework out of SAMHSA. So the Strategic Prevention Framework, for those of us in the prevention world, is our PBIS, right? These are identical guideposts to walk through how to implement a cultural assessment, change, and the support structures necessary that included partnerships so that people didn't feel tapped out with resources. We wanted a way that it created a buffet of prevention options for anyone who was interested. We talked with teachers who feel that they weren't supported by their administration, or administration in schools that felt like they weren't supported by their local prevention coalitions, and we wanted to empower everyone so that they could come together and create more strategic partnerships so that fit together like a puzzle. We had highlighted efforts from around the state, really important. I think Amy talked about, we have many efforts and interventions happening around the state around prevention, but we don't know them. There's not a clearinghouse for them because they have separate funding initiatives. Some of them are homegrown in a community, some of them are funded federally, locally, and some of them are driven out of different stakeholders in a community. So we wanted to find a way to highlight what was working in the framework of the Strategic Prevention Framework. And thus the Drug Use Prevention Education Resource Guide came to to life. You'll notice that we don't have as many paper copies circulating as we did the initial 15 recommendations. That's because we decided to generate an online profile so that it is a living document. We'll talk a little more about that when we go through each of the recommendations. But to highlight, we took a culture of no one right way to do prevention. We know that there is a guideline for prevention, there's best practices, there's evidence-based prevention, and absolutely we want to champion that. But we don't want to isolate people and spend a lot of time telling teachers and communities that they're not doing it right. We want to say, here are ways to be successful with your idea and your initiative. We really put an emphasis on involving the community and making sure that it was right size and a fit for the community. We'll talk later about gap analysis and needs assessments and how very important they are. Sarah touched on this as well in her toolkit. Best practices and evidence-based, we hear this a lot, but really helping communities understand the value of having measures and scales, both for their validity, their fidelity, and for funding opportunities in the future. We try to avoid and educate about scare tactics. And so scare tactics are this baseline thing that many of us think we understand, but so much good work is happening, and then ultimately it's a scare tactic. And how do we take that and help educate community members without minimizing or squashing their enthusiasm for doing prevention? And we really embraced the philosophy in writing this guide that nothing for us without us. That means nothing for a community without the involvement of that community, whether that be youth-led prevention in classroom and making decisions with teachers, with administrators, and with community coalitions. So the resource guide should be inclusive, and that means that anyone can pick it up anytime. We provided checklists. So for those of us who really appreciate having a task list that we can check off and feel like we're getting closer and closer to a mark, I think these are crucial, especially in doing prevention, because prevention doesn't frame results quite as quickly as sometimes treatment or even recovery can. It's important to use checklists to know that we're on the right track, but also to feel like we're creating momentum and movement. Again, we focused and relied on the strategic prevention framework. Spending any time with that and PBIS, you'll recognize that they can be used in lockstep. We used examples around the state. So my colleagues and I spent a good amount of time making sure that we were reaching out to as many counties as possible to highlight their good work in prevention, so that we weren't always looking outside of what we have available in Ohio, because there are some amazing things that happen right here at home. We included portions of questions to ask. So these are guides to start conversations, stakeholder building, and decision making in your community. We spent a lot of time talking in the guide and walking you through several different examples and tools to utilize gap analysis and school surveys, stakeholder surveys, and advisory committees. These are important because though we are in the middle of an opiate epidemic and many people are looking for solutions and prevention around the opiate epidemic, much quality research and development and prevention programming exists that has existed since the 80s and continues to be valid. Again, using school and climate surveys really gives you an assessment of what young people in your community are actually doing. And many times when we are engaged to address the opiate epidemic in a prevention framework in a community, we realize that it's not opiates that the youth are engaged in. It might be some mental health issues, it may be some other adverse events happening at home, and it might be other substances of abuse. So before you are the 15 recommendations, and we broke each of these down into trigger point examples that people could look at, see that were happening around their communities, their other counties, and each example provides a contact information for a specific person in a community that is overseeing that program. We talk about before and after school programs being crucial. We know that research tells us that the hours between 3 p.m. and 6 p.m. are the hours of unsupervised time that are put youth at highest risk for risk-taking behaviors. So that's an entire gamut of information. But when we reached across our state to look for examples of before and after school programs, we saw that there weren't a lot out there. So we really strove to show models and to highlight examples and to seek out funding opportunities for folks who are interested in propping up before and after school programming in their community. We looked at cross-curricular prevention education. Those were highlighted by Amy when she talked about, she had a slide that shared, for example, the HOPE the HOPE education curriculum in Ohio. Health education curricula Social emotional learning, again, Amy touched on this as well. School climate and drug use surveys. So again, really kind of getting your finger on the pulse of what the climate is in the school, how youth and families feel that they can engage, as well as how teachers feel that they can engage with community coalitions that are happening. We focused a lot on examples of ADAM board engagement. So that's your alcohol and drug and mental health boards. So many times working in communities, we recognize that there might not be a strong relationship to the ADAM boards, and we really want to foster that. So as a funding resource, and because the ADAM boards provide networks that employ these specialists that are licensed to do much of the work that support the services in the school, such as social workers, licensed clinical counselors, as well as certified prevention specialists. We looked at many examples around the state of caregiver engagement, how important that is of finding ways to engage families. And again, because we are in the middle of an opiate epidemic and the structure of family looks very different, we had to find ways to include all types of family. We looked at law enforcement engagement beyond DARE and put great emphasis on explaining more of what DARE involved and those drug use prevention grants out of our office. We looked at youth-led prevention such as Youth to Youth and We Are the Majority. And we focus quite a bit on community-based health referrals that Sarah is going to talk about more, as well as school-based healthcare services. Again, we talk about our document being a living document. We wanted to focus on programs that were happening around the state so that we could provide a clearinghouse for those. As we wrap up our time together here, you'll have my contact information. I hope that if you feel like your program was missed or should be highlighted in this document, that you'll reach out to me immediately so that we can include your efforts. The link is provided for the document. It can also be found at ohioattorneygeneral.gov, and you can contact me directly for copies of the document, as well as a guide for entering your information or anything you would like us to review. Ohio Attorney General Mike DeWine, as you know, for 7 years has been dedicated to impacting the opiate epidemic with a holistic model approach of how to approach families in prevention. Some of those include the work of our heroin unit, Foundations for Youth, which is a police-led youth drop-in center in Circleville, so completely unfunded and completely staffed by volunteer police officers. Head Start referrals, working with law enforcement agencies so that they can make direct Head Start referrals for early childhood education. And 30 Days to Family, Ohio Start, both of these are child welfare services intervention programs that strive to keep families together. Here's my contact information. I hope that you'll reach out so we can have a further conversation about how to implement prevention in Ohio. Thank you for having me.
Thanks, Tia. This is Sarah Wickham again from the Ohio Department of Education, and I want to talk a little bit about how health fits into the new Ohio strategic plan. So ODE launched the strategic planning process in the summer of 2017. We engaged more than 1,300 Ohioans, parents, teachers, business leaders, community members, et cetera, to put together a document that represented a vision for what education should be in our state, what we wanted for all of our children. The final Each Child, Our Future plan does just that. You can see this one-page document is an overview of the plan. The full plan is available on the Department of Education's website. I want to draw your attention to the fact that at the center of this graphic is the whole child, and the entire plan is focused on meeting all aspects of a child's well-being, the physical, social, emotional, and intellectual needs of the children we serve. So I want to walk through and quickly talk about some of these different aspects of the strategic plan. So as you can see that our vision is that in Ohio, each child is challenged, prepared, and empowered. So they're challenged to discover and learn, prepared to pursue a fulfilling post-high school path, and empowered to become a resilient lifelong learner who contributes to society. We have one goal for our children. We want in Ohio to increase annually the percentage of its high school graduates who, after 1 year after graduation, are enrolled and succeeding in post-high school learning environments. So that could be adult career tech education, an apprenticeship, a 2-year college, a 4-year college, serving in the military, earning a living wage, or engaged in a meaningful self-sustaining vocation. There are 3 core principles in the strategic plan, including equity, partnerships, and quality schools. I want to talk specifically about partnerships because everyone, not just those in schools, shares the responsibility of preparing children for successful futures. The most important partners are parents and caregivers who have the greatest impact on a child's development. But other critical partners include educators, institutions of higher education, business, philanthropy, employers, libraries, social service organizations, community members, healthcare providers, behavioral health experts, and many more. Put simply, partnerships transform the education experience. We also highlight 4 learning domains: foundational skills and knowledge, well-rounded content, leadership and reasoning, and social emotional learning. And all of this learning is predicated on the fact that students have to be at school with their heads in the game. They have to be there and they need to be engaged, and that is all based on their health and wellness. We also list 10 priority strategies. You can see the first 5 of those here. Highly effective teachers and leaders, principal support, teacher and instructional support, standards that reflect all the learning domains, assessments that gauge all learning domains. The next 5 are here: accountability system that honors all learning domains. And then number 7, which is the most relevant for our conversation today, meet the needs of the whole child. So that whole child approach that I described at the beginning of my comments means that our students are healthy, safe, engaged, supported, and challenged. We also are focused on expanding quality early learning, developing literacy skills, and transforming high school to provide more paths to graduation. We would love it if you would visit our website, education.ohio.gov/strategic plan, to see the full plan there. There's a lot more information. I ran through it very quickly, but this is really the guiding document for us, for the Department of Education, for the State Board of Education, and for all other education stakeholders to know what we want for all of our kids. I will turn it back over to Amy with some poll questions.
Hello, everyone. We have a few minutes to take questions or comments. Please use the question or chat box to submit any questions that you have, and either I will answer them or I will pass the headset around to someone else who's here who can answer your questions. So I think, and we're actually going to start with a poll question. As a result of attending this webinar, can they see this? Okay. As a result of attending this webinar, I have increased knowledge of the connection between education and health. So please quickly just indicate your level of agreement. And at the same time, you can be typing in any questions that you have. Okay, we're going to close that one out and go to the next poll question. As a result of attending this webinar, I have increased motivation to download at least one of the policy briefs. Have some, positive reactions here in the room. So please select your level of agreement with that. Okay. And one more. Overall, how would you rate the quality of this webinar? You stuck with us till the end, so that's always a good sign. All right. Now, let's see if I can figure out how to see the questions. Can we make it bigger?
So it says, can you please provide a brief
reason
as to why Ohio doesn't have health education standards in place?
I think that there has been a lot of concern that health education standards would be too controversial. I know that there's always concern that anything related to sex education will be too much of a hot button issue and is very controversial. And so for that reason, I think there's been reluctance to take on health education standards. The current bill that's pending actually specifically says that sex education would not be addressed in the proposed standards, and that would still be up to the individual school district. So I think that's the current approach to overcoming that barrier.
Okay, our next question is, in the Ohio Strategic Plan, Each Child, Our Future, have you integrated health in all policies?
Sarah, are you familiar with that term? Do you want me to say a little bit about what that is? Okay, sure. So health in all policies, or health and equity in all policies, is an approach where you consider the potential health impacts of different policies, programs, things happening in sectors beyond health. And so the question, I think, is getting at, when you were putting together the strategic plan, how did you kind of think about health? Were you thinking about health outcomes? And how was that kind of integrated as part of the decision process?
So that's a really good question. And I think that what I didn't say much of for time perspective was how we came to pull together the strategic plan. So we had regional meetings throughout the state where we engaged with parents and educators and other education stakeholders all across the state to hear from them what their priorities were. And certainly there were health elements that were absolutely part of those conversations. We heard a lot about the opiate crisis. We heard a lot about students coming to school that needed some mental health supports. And so that is why we really took this whole child focus. Was this, among other things, really led us to realizing that schools need to do more than just teach math and science and reading, and that we need to be focused on these partnerships that can provide expanded services to kids. And so I think that is how we thought about health as part of the strategic planning process.
Okay, next question here. Have any surveys been done to examine the mental health and possible drug access or use of elementary school students, especially in high-risk areas? The YRBS only covers middle and high school students. So the question is about elementary level surveys. I am not familiar with any, but Tia is shaking her head, so I'll turn it over to Tia.
Yeah, thanks. This is a great question. I know that we have free tools to us, including the OES and the PRIDE survey for doing drug climate assessments, but there's a lot of great information available via the Search Institute at different levels of assessing climate in schools, whether that's elementary, middle, or high. And all climate surveys involve community and family surveys, so you should be getting kind of an assessment of the whole community. Additionally, I would reach out to your local ADAM board, your Alcohol and Drug and Mental Health Board, as they often fund those surveys, and find out when the last one was done in your community and what tool was used.
We have a question about whether or not the slides will be posted. We will definitely be posting a PDF of the slides that we use today on the event page of the HPIO website. And we could also post those on the education resource page as well. We've also been recording this webinar, and we'll post the recording there as well. And let's see, do we have... what is the status of the Health Education Standards Bill since it was introduced in 2017? It hasn't really gone anywhere. I'm actually going to turn it over to Becky to say a little more about that.
Sure, thanks, Amy. We're not completely sure if it's had one or two hearings in the Senate Education Committee. It has been heard, but it still has not made it out of committee in the Senate. So it does have a ways to go. And the question also asks, will it be introduced for the next General Assembly? We really have no way of knowing that. We'll have to see if if any of the senators or representatives want to introduce it again.
And with that, we thank you very much for attending this webinar and for your great questions. And we hope that you will check out the Education and Health Policy Brief series on our website and some of the other materials that were discussed today by our guests. Have a fabulous rest of your Wednesday. Thank you.